So welcome everyone to our first open day of 2023. Really looking forward to telling you a bit more about our online Master of Public Health program. My name is Serena Luchenski and I'm one of the co-directors of the MPH program, and I'm joined here today with my fellow co-director Dennis Stefler, as well as our education coordinator Rahima Khanum. So hello everyone. So how we're going to run the session is I'm going to do a presentation, which is quite comprehensive, should tell you hopefully everything that you need to know, or most things you need to know about the MPH. And then we're going to have time for questions after the session for you to be able to ask us all of your questions. A couple of things first. If you've signed up for this webinar, we don't have permission to take your details from the central UCL system. So if you would like to find out more about the program, to get updates from us, or to book a one-to-one with either Dennis or myself, Rahim is going to pop a link to the chat. So if you could please fill in just your name and email address on there, then we can get in touch with you and let you know more about upcoming events and more about the program if you'd like to sign up. As I said, we'll do questions at the end. You'll see there's a chat box as well as a Q&A box. If you could put your questions into the Q&A rather than the chat, it just makes them easier for us to manage. And it's fine for you to pop questions into that Q&A box at any point throughout the presentation, so you don't forget your question. You don't have to save it to the end, and then we'll just address them all at the end. So I will start sharing my screen and start off with the presentation.
Shall we just do a little introduction? I was wondering.
Oh, of course. Sorry, Dennis. You go ahead.
Yeah, just very briefly. I think it's really good to have everyone here. I'm the other co-lead of the program. My name is Dennis Stefler, and I'm a lecturer in epidemiology, and obviously working fully in the Masters of Public Health here at UCL.
And Rahima.
Yeah. Hi, everyone. I'm Rahima. As Serena said, I'm the education coordinator for the MPH program. I'm the lead for all our online programs in UCL. So yeah, nice to meet you all.
Great. Thanks, Rahima. Yeah, and I guess I could just say a little bit about myself as well. So I'm a public health specialist by training and a clinical associate professor here at UCL. So I will head on to the presentation now without further ado. Right, so welcome to this Q&A and information session for the MPH, as I said. So firstly, just to introduce you to a little bit about who we are, a little bit about UCL. So UCL is global top 10 university, and we're actually top 5 in the world in the most recent Shanghai ratings for public health. This master's program is hosted by the Institute of Epidemiology and Healthcare, and that department has a huge range of interdisciplinary expertise across population health sciences. However, we also work in partnership with lots of different academic disciplines across the university, as UCL is a multi-faculty university. We work with NGOs, with ministries of health, various education institutions across the UK, the National Health Service, as well as enterprise and social businesses as well, to improve health. And there's a lot of dedication, years of experience in this institute to building capacity and developing teaching, and particularly around master's programs. So we run a number of face-to-face programs, and this is the first online program that our institute is offering, and is one of the flagship programs for online learning across UCL. So what distinguishes our program? So firstly, the curriculum has been comprehensively mapped against the UK Faculty of Public Health, as well as the World Health Organization ASFA curricula for Europe for public health professionals. So these are two really well-known, internationally recognized curriculas for training public health professionals. As I mentioned, we're a multi-faculty university. We're performing at a very high level internationally, and you can expect high quality teaching from internationally leading researchers across various different disciplines. So we're a highly interdisciplinary program, and we bring in people from across faculties such as the built environment or anthropology, or lots of other health and social sciences across the university. And I think one of our key USPs is that we've got unique careers-focused core themes, which have been interwoven into the entire program. So these 6 core themes, the first is interdisciplinarity, which I've talked about already. The second is around health inequalities. So there's a real strong focus on how do we measure them, how do we tackle them, how do we address them as a modern public health workforce. The other elements are around the involvement of citizens as well as practitioners and policymakers. So this is about getting the real life experience of both the people who are affected by public health issues, as well as the practitioners who are working and policymakers who are working to address these in the real world. So you get to hear from a lot of different people, not just academics, on our program. In addition to all of the sort of core knowledge around public health, we have a strong focus on core skills so that you're walking away from this master's program with the skills that you need to be able to work as a public health professional in the real world. So this is around, quantitative and qualitative research skills, but also around communication, leadership, advocacy, and so much more. And then finally, and related to all of this, is a focus on how do we actually implement public health interventions in our practice? How do we take action and how do we achieve impact in the real world? So again, the assessments that we've developed, the tasks that we work on are all focused around how are we going to be delivering this impact in the real world. Just to give you a bit of an overview about the program now. So in terms of costs, it's £18,000 for a full-time student, and you would be starting in September. And I'll tell you a little bit about dates a little later on in the presentation. In terms of how long it takes, if you're full-time, and that is full-time, we don't anticipate people to be able to work full-time alongside this. It is a 12-month program, so you would start in September and submit your final dissertation in September of the following year. You can also do the program part-time, so 50% over a 2-year period, or a lot of students are taking up the program as a modular flexible option, which means that you can take any number of modules that you like, and you have up to 5 years to complete the program, and you can do it in less if you'd like, but it just gives you that maximum flexibility. And as I've said, this is a fully online program. So who is this program for? It's really targeted at people who are really interested in the big picture, who want to think about the health of whole populations and to make a difference at that population level rather than, say, an individual level like a medical practitioner would do. You'll gain competencies across all of the core areas of public health, and this is ensured through our mapping exercises that we've done in designing this curriculum. You'll develop research and practical expertise, as I said, around communication and influence and leadership. And you'll cultivate the knowledge and skills that you need to be able to tackle all kinds of public health problems that are well known and those that are emerging globally. In terms of admissions, we require people to have a UK 2-1 or overseas equivalent of that. We require a UCL level 2 in terms of English language. So that sort of translates if you've done IELTS at a level of 7 or above overall, with no area less than 6.5. We also need to have people to have a certain level of numeracy skills, because there are some quantitative subjects covered by this program. So we say either a UK A-level maths or statistics, or at least one quantitative module taken at an undergraduate level with a first class or a 2-1 mark, or obviously the international equivalent. We also would like you to submit a personal statement about why you want to study public health, and all of this information is detailed a bit more in the application and on the prospectus page. But also, we do welcome graduates who may not have all of these requirements, who have at least 2 years of relevant work experience. And you're welcome to discuss your situation with us individually, and you're very welcome to apply. And we definitely have students on the Masters this year who don't necessarily have had all of these background sort of requirements, but have that professional experience and enable to be able to do the Masters. So who is the program for? So it's really targeted at people who are envisaging a whole range of different careers. So people who might want to work at a local level or a national or an international level, but again, the focus on the health of whole populations. The program is suitable for new or recent graduates if you've got a background in health or sort of social science, particularly quantitative social science, but also for those who've got the relevant work experience, who might be working in a public health department or related job already, and you want to be able to take your career to the next level. Similarly, I think for a lot of health professionals, we've got a lot of medical doctors and nurses and midwives and allied health professionals who are looking at, branching out from their clinical backgrounds into more population level work. And this is a really suitable program for those students as well. And and in terms of future careers, I think people who are thinking about working in either health service or policy, perhaps data intelligence, or even business consultancy, all of those backgrounds and ambitions are very suitable for our program. In terms of the structure of how we teach, it's fully online, and we have a combination of materials that you complete in your own time, and as well as materials which you do in a live Zoom session like this, where we're all together at the same time. So, there's a combination of recorded lectures, as well as group work and other learning activities, readings, and so on. And then you have a weekly live session for each module, which is about 2 hours in length. And so if you were a full-time student, you would be doing that 4 days a week. And I'll show you a sample timetable in just a moment. As I've mentioned, we're very flexible, so you can take up various modes of study, but everybody has to complete 180 credits, which is a standard UK master's degree. And there are 7 compulsory modules, 2 optional modules, as well as a dissertation project. The assessments on this program are really varied, and we have everything from written examinations to coursework, essays, presentations, group projects, and of course the independent dissertation project as well. So this is what the MPH structure looks like. So if you were a full-time student, this is what you would do. And there are sort of 4 phases of our program. So the first phase is term 1, September to December, and that is the foundation of your program. These are all compulsory core modules. You would do fundamentals of interdisciplinary public health, applied epidemiology, and statistics for public health. And these modules really underpin the whole program. In term 2 is our expansion phase, and you would be looking at health improvement, health systems organization, and economics, health protection, as well as leadership management and communication. So really expanding on those core disciplines that you've learned from term 1. And those are all compulsory modules as well. In term 3, you have an opportunity for some specialisms. So you would choose 2 out of these 4 optional modules. So we've got applied quantitative methods for public health, which is expanding and going deeper on the epidemiology and statistics side of things. Applied infectious disease epidemiology, which is building on the epidemiology in term 1, as well as health protection in term 2. And then you've got qualitative mixed and participatory research methods, as well as urban health. So you can choose any of those. And all of these top modules are then integrated into your dissertation project. And the main sort of period for the dissertation is over the summer, but you get started on it very early on. Even in term 1, you begin thinking about this dissertation project to really integrate all of the skills and knowledge that you've gained across the program. If you are part-time, we recommend that you start with fundamentals. So the modules that you wouldn't take are grayed out. So we would recommend you start with fundamentals. And then in term 2, you can choose any 2 of those modules. And in term 3, you wouldn't be able to do applied quantitative methods or applied infectious disease because you wouldn't have the prerequisites. So that's why they've got that little red star on there. So you need to have some prerequisites to do those. But if you wanted to do both of those in your program, so in year 2, this is the year 2 slide now. So you've finished fundamentals. You do your epi and stats in term 1, 2 term 2 modules, and then you can choose any of the term 3 optional modules because you'll have had all of the prerequisites. But if you're part-time and you want to take both of these 2 modules with the star on it, you would need to discuss it with us to see how we could maybe make that work for you. And then just finally, if you're a modular flexible student, you've got ultimate flexibility. Again, we recommend you start with fundamentals, but then you can do the modules at any pace that you want to do, but just bearing in mind those prerequisites for those optional modules. And for both the part-time and the flexible students, you do your dissertation, again, the main focus of that would be in the final year of your studies. So this is just a sample timetable for the week, and this is subject to change before the start of the year, but this is quite likely how it will look. So you will have live Zoom sessions on 4 days a week if you're a full-time student, and each module has live sessions on 1 day of the week. Accounting for the fact, as you've seen by all of the different countries represented here, we offer 2 live Zoom sessions per day so that we can account for the different time zones that people might be in. So we have a morning session as well as an afternoon session for students to be able to join the one that's most convenient for them. And we recommend that you stay within the same session for a whole term. But obviously, if this week you need to do a morning instead of your usual afternoon, that's no problem. And we offer that flexibility. So you can see we've got 2-hour sessions, 9:30 to 11:30 UK time or 2:30 to 4:30 UK time. These are the provisional term dates. They probably won't change for next year. So there would be a welcome week, 5 days, the last week of September, and then term 1 starts at the beginning of October, and teaching runs till mid-December. And then again, about 3 months for term 2, but then term 3 is a shorter term. So we still need to pack in the same amount of material, but it's packed into 7 weeks instead of 10 weeks. Just to say as well that these are the core times where you will be having synchronous teaching. So you'll be having the live Zoom sessions. But that said, the assessment periods run throughout the whole year. So while you won't have, scheduled classes at this time, you'll still be expected to be working over the Christmas period, or, there's a month from the end of March to the end of April, where between terms 2 and 3, a lot of assessments and things are due in this period. So it is very much full-time. It's just more flexible outside of these dates. In terms of funding, so we have a dedicated scholarship for our program, the MPH Impact Scholarship, and there's 2 of them. And if you're full-time, it will cover your full fees. And if you're part-time or flexible, it will be pro rata. So that means that you will be given £18,000 if you're successful. And if you're part-time and the fees go up, there might be a financial implication to you if the fees increase after this year. So, there's a sort of incentive, I guess, to finish your program more quickly if you are awarded a scholarship. There's lots of other different types of scholarships as well. I've posted a link here, and I think Rahima will put it in the chat as well. Links to both the MPH scholarship, but also UCL's scholarship finding application, where you can see what other scholarships you might be eligible for as well. In terms of the student community and support careers aspects of the program, as I said, we've got the welcome week. So we have a whole set of induction activities to get you ready for the program before we start. And then throughout the year, you have regular contact with all of your module leads. We've got a program of different events and resources available. Everyone is allocated a personal tutor who you meet at least twice per term to talk about your well-being and career ambitions and any sort of issues that you might be having on the program. We have a very lovely dedicated MPH student advisor who, again, is going to help support you with your studies and your well-being needs, and will be checking in with you with any issues that you might have. And then everyone has access to all of the UCL services, so around careers, well-being, academic writing support, alumni networks, and all of those things. So just because you're online and not physically at UCL, you're still able to access all of those things. Also, if you are London or UK based, or even if you're just visiting in London, everyone on the program has the ability to get a student card and come to UCL, use the libraries, use the Student Union Center, which is brand new and lovely. You can use all of those facilities available to our face-to-face students, even though you're an online student. And there's various extracurricular activities which might be organized through UCL centrally or organized by yourselves, by the MPH students yourselves. So as I've alluded to earlier, there's a whole range of possible career destinations for the people who do an MPH program. There's just so many different skills that you'll gain on this program that you can do a lot of different things. So just a few examples here. So public health practitioners, either working within government or within a healthcare system, looking at a whole range of different topics. I just gave some examples here around lifestyles or green spaces or, diabetes prevention. There's any number of topics, and the skills that you get here enable you to do this type of work on lots of different topics. Some people will go into policy, whether that's regionally or nationally. Other people will focus more on, say, public health intelligence, so looking at working with data, working with evidence, doing reviews and that sort of work. Lots of roles as public health advisors in the non-governmental sector, so whether that's a local charity or big intergovernmental organizations like the World Health Organization or UNICEF. There's lots of different opportunities. And of course, academia and research for those who would like to go on to a further research background, a research career. So here is a link to our prospectus if you haven't accessed the page already, and our team Rahima's email address for those who would like to contact us, and Rahima will put these links into the chat as well. As I mentioned, if you could please put any questions into the Q&A box and give Rahima your email address to sign up for a one-to-one or hear more about the program. Just for convenience, here's a QR code for anyone who would just like to scan that and get straight into the prospectus page. So I will stop there and we can take any questions.
Thank you, Rahima. Thank you, Serena. That was a really nice presentation, I think, and thank you, Rahima, for posting the links to the chat. So hopefully everyone have access to these links now. We have a number of questions in the Q&A forum, which is nice to see. And I will take some of them just to give Serena a bit of a rest. I think maybe you can have a cup of water or something. Just to start off with, question came that, is there an equivalent course taught in person? So as an answer to this question, I would say that there is no other Masters of Public Health program at UCL. This is the only one, and this is online. There are other MSc programs which are similar to some extent in terms of coverage of topics, such as the MSc in social epidemiology, the MSc in population health, maybe the global health and development MSc, but they all have slightly different focus. Let's say social epidemiology is more specifically about social inequalities and epidemiological aspects. Population health and global health, I think they have many more optional modules and a wider focus. I think our program is specific in a sense that it is targeting or covering fully the public health discipline, and while there are overlaps, I think in this aspect it's quite unique. Don't know if Serena, you wants to add something.
Yeah, I would just add, so an MPH is a different qualification, and it's recognized as a sort of professional qualification in a lot of different careers, and employers will recognize that as a qualification which is comprehensive to all areas of public health. An MSc, however, you might have, you know, as Dennis said about the different optional modules and things, it allows you to be more specialist and perhaps slightly more focused on research rather than a sort of broad public health career.
So hopefully that was a comprehensive answer. Next question. If you are a UK home student, can you complete the course from anywhere in the world? Absolutely. So just because you are UK based, it doesn't mean that you have to be in the campus. You can be anywhere. Just we will treat you if you are in London or in the other end of the world, in Australia or Asia or the Americas. The requirements, the format, the way you access the content will be identical. So absolutely, you can be anywhere and you will have the same experience as if you are sitting in the next building to UCL. Next question. What is the main difference between this course and global health and development? I want to be a health policy analyst eventually in a developing country. Which of these courses would be a better choice for my career? I mean, I have to admit, I'm not fully familiar with the global health and development MSc. I can repeat what I mentioned before, that it has a different focus, but I don't know, maybe Serena, you have a better overview on this.
Well, so I mean, it really depends on your individual situation. I think both programs, you know, would be suitable for that type of background. But I think it depends, you know, what your focus is. I'm not that familiar with the global health and development program, but I think that does have a more low and middle income country focus, whereas I would say, you know, we're a real mix of focusing on high income and low and middle income countries. So we draw on examples from across the globe, and so we're not as specific. So that might be something that you want to consider. But also I think, you know, this is a good opportunity to say, you know, if you want to book a one-to-one with us and actually ask us more specific questions about your personal situation and what you're hoping to get out of the program, then we might be able to, you know, at least advise you from the MPH side, and maybe you can book a similar type of conversation with the program leads for the other MSc. And I think that's probably the best way to look at it.
Yeah, and then I'm sure they also do open days like this one. So I think it's worth attending that one, and you can make a well-informed decision. Next question. Would there be any disadvantage to taking this course fully online rather than in person? Well, firstly,
I think the question, well, obviously it's fully online, but I think the question is maybe doing an MPH fully online rather than in person, don't you think? Maybe that's what we're asked.
Yeah. So I think it is more to, if there was a in-person MPH, whether we would, what would be the difference between the two? I mean, I think this question applies to any online program in relation to face-to-face. So there are advantages and disadvantages. I think we have to accept that. I think a lot of advantage is the flexibility, accessibility from wherever you are. Of course, you won't get that same individual level experience than what you get if you go to a face-to-face program and visiting and attending classes in the lecture hall. However, what I would add that we do offer a lot of in-person hours and possibilities to connect with each other, for students to connect with each other and for students to connect with lecturers and tutors, of course, online in this environment. But there is a lot of opportunity and time to talk to and ask questions and discuss, so you won't be left alone. And in that sense, I think yeah, this is one of the strengths, I think, of our program. But there are differences definitely in relation to face-to-face. Don't know, Rahima, you wanted to say something.
I was going to add in the other one is the student experience aspect of it, is the fact that if you're face-to-face, you have a community that you can meet up with and you can mingle. We try to accommodate that for our students with our Moodle pages and community, setting up our online community. However, I think that's a bit of it's something that you might not get because one of your colleagues might be based in a different part of the world. So it's how interactive and how much of a community you want to be will affect that.
I think the last point I would just add around that, I mean, the main advantage of an online program is ultimate flexibility. You don't have to move to London. You don't have those costs and expenses. You don't have to give up your lives, move your children, give up your job, all those kinds of things. And so the online environment is particularly suited for people who've got that. For people who want to say, just drop everything, move to London, have the London experience and do a face-to-face program, you're probably, better off in that environment to do that face-to-face. But if you've got these other commitments, I think it's much more inclusive for people who've got those kinds of backgrounds and don't have that sort of mobility. I think the other fantastic thing about having an online program in terms of this inclusivity aspect, it means that we literally have people from South America, North America, Asia, Africa, Europe, like Australia. We have people from all around the world in our program, and I don't think we get that rich of a diversity of students and getting to network and meet people in a global context so effectively when we're requiring people to move to the UK and come face to face. So, I mean, I think there's some good advantages here, and obviously it depends on your experience. In terms of the qualification and the teaching, you get a UCL Masters, you get a UCL MPH, regardless of whether you're doing it face to face or online, and it's the same standard, the same qualification, and you still get that that degree at the end of it. So yeah. Something for you to think about. We better move on to the next.
Yes, I think there are lots of questions left and the time is short. So what are the main things or ideas you are looking to see in a personal statement for the application? I mean, I think we're looking for dedication and a bit of passion towards public health, or at least definite interest in this area, because then we feel that you will engage and you will perform probably better if you do something you really like. So we do look for it. We obviously look for academic skills in terms of writing skills. So we do like, or it does get better view if it is a well-written statement. I don't think we have a requirement of how long it should be, but it shouldn't be too long, but it shouldn't be too short either. I know this is very vague, but like a reasonable length. But we do try to pick up a few skills that are required for a good statement. I don't know if there's anything to add.
So the thing I would add is that if you are one of these people who don't necessarily meet the required all the required academic standards that we've set out, the personal statement is the main thing that we're going to be judging your application on. And so if you've got that experience, you've got, you know, those years of work experience, and, you know, maybe you haven't got a 2-1, maybe you had a 2-2 in your undergraduate degree, but you've got this experience, which is demonstrating to us that you've got the knowledge and the maturity to be able to undertake a master's program, then that's kind of what I would be looking at in that statement, is that, you know, do I believe that that you're passionate, you're knowledgeable, and you really want to do this program, and you're willing to put that work into it, and what those 2 years, minimum 2 years of experience are. So yeah, I think if you don't meet all of the requirements, that statement is really important to make sure you get that.
Okay, next question. I took a statistics class with a module on my undergraduate course. Is this enough for a numeracy requirement? We looked at chi-square test, coding using R, and other statistical tests where I had first on the exam. But I would say that it is more than enough. It is more than enough. We don't expect actual statistic background to apply for the course. In fact, we start from very, very basics. We do expect very simple numeracy skills. Even I think most of you can acquire it in secondary school, I guess, or undergraduate studies, because especially for statistics, we understand that many of the students don't have any background. So we start from very basic, but we do progress gradually to a fairly high level, especially if someone is taking the advanced statistics module in term 3, then you will gain quite complex statistical skills. But yeah, I would just say you don't need to worry about this with this background. If the course is online, in terms of presentations and examinations, would they be online as well?
Yes, everything is fully online. Yeah.
Yeah, absolutely. All the assessments are online. If you are awarded the MPH Impact Scholarship, can you also access the UCL Master's Bursary?
There's no need to, because the Impact Scholarship covers your full fees, so there's no cost to you for the program, and because it's fully online, there aren't any relocation costs and so on. So I don't think that you can get both. Rahim is shaking her head.
Yeah, no, you won't be able to get both. You'd be either awarded one or the other. And like Serena said, the Impact Scholarship covers everything, all your costs. So we wouldn't expect you to need another scholarship to cover.
Okay, next one. So the next one is for me because it's about dissertation, and I'm one of the dissertation leads of the in the program. Are you assigned a supervisor for the dissertation? If so, do you connect with them virtually as well? And linked to this, are you assigned a general counselor or someone to support you individually throughout the course? Yes, so this is a very good question, and it refers to 2 different types of support that you receive in the program. One support is definitely the supervisor, whose work is very specifically related to the dissertation, as you said. Just a few words about the dissertation. You or all students are encouraged to bring their own topic for the project that you want to work on. So we really encourage you to work in something that you are passionate about. So the idea for the project is developing through term 1 and term 2. And towards the end of term 2, so around March, you are assigned a supervisor who is an academic staff in our institute. And that supervisor will support you in the actual carrying out part of the project, writing up, doing the analysis, and until the end, until you submit. The other support that you get is the personal tutor, and that was mentioned by Serena in the presentation. Is a bit more kind of pastoral care and academic support, in a sense, to help you through the whole year, and not specifically focused on dissertation, but more in terms of how you are doing, you know, health-wise. If you have any problem, you can approach them, or if you need any support in writing support or anything else, this personal tutor can signpost you to the right place in the university. So maybe a kind of first point of contact. Is there anything else to add about this?
No, I don't think so. I think that was great.
Okay, next question. How are you scored on the MPH? Do you get the first 2.1, or is it scored differently? I can say, so you score differently. So this every assessment is scored on a scale between 0 and 100. And you need to achieve 50 marks, so 50% to pass. If your mark is somewhere between 50 and 60, then you have a pass. I think it's called grade or some kind of label. Between 60 and 70, it's a pass. Then between 60 and 70, it's merit. And if you achieve over 70, it's a distinction. So it might be slightly different to what you have done before, because in other universities there is different system, but this is what we use here in UCL on all assessments. May we apply through UCAS or through the university website only? Rahima, this is yours, I think.
Yeah, so you won't be able to apply from UCAS because UCAS is mainly for undergraduate students. You have to apply through the university only, and our link to the application is on the prospectus page, which I have shared, but I will share it again once we finish one more time. I'll share it in our chat so you have access to that. And all the link portal is open for applications right now, and the deadline for that will be the 30th of June 2023.
I wonder, Rahima and Dennis, because you're sort of managing it, if people were to apply next week, let's say, what's the sort of timescales that they might expect in terms of when they would hear about the success of their application?
So from our point of view, this goes into the nitty-gritty technical aspect of it. So the process of actually applying, once you submit an application, it goes to UCL General Admissions team. They will screen through your applications, and if you meet all the basic criterias and the trigger points of your personal statement, they will automatically give you an offer if it's straightforward applications. If they have any queries and if they want to check it, they will pass it over to us as the program team, which we refer and send it back. And then it stays with them. Bear in mind, UCL, they have a wide range of MSc programs, and they are trying to accommodate all of them. So we can't actually give you a specific time frame on when you would hear.
Is it about 8 to 12 weeks?
That is the goal that they do try to push, but it's not confirmed because, again, of other affecting issues.
So apply early, basically. If you want to make plans for your life, and there's a lot going on. The face-to-face programs close the end of March, so they will prioritize those programs before our program in terms of getting everything processed. So we'll get back to you as soon as you can. If you don't hear from us right away, or you don't hear from UCL, it's fine to drop Rahima an email, and
we can chase it up. Yeah. I think the information I'll share is apply early. The later you leave it, then it gets piled up with more other programs and stuff like that. So it is best to apply as soon as possible.
Correct.
Yeah. We still have quite a few questions, so I think we need to be a bit swift.
Yeah.
Will fees increase for September 2024 start date?
We don't know yet, do we?
We don't know.
We don't know.
We don't know. Yeah, it did increase slightly this year from 16,000 to 18,000. We don't know what's going to happen next year.
Yeah.
How many people are accepted to the program and how many people apply?
So, I mean, I think the question really is about, you know, how likely are they to be accepted? Because we're an online program, we don't have limitations in terms of, you know, room sizes and buildings and all of that kind of stuff. So if you meet the criteria, you apply on time, you'll get a place. You know, we're aiming for a minimum of 75 new students to join us this year. But we've got part-time students who are with us this year who will be carrying on next year. So yeah, it's a good number of students. There's lots of people to get to know, but we do, as Dennis just mentioned and I've talked about, you know, really endeavor to have a personal touch to everything we do and have a lot of, you know, contact with you with the Zoom sessions and personal tutoring and all the rest of it. So yeah, hopefully we're hoping for probably across the program, including our part-time students from this year and new students next year, probably around 100, I would say, for next year.
Yeah. As an international student, if I were to apply, would I get a student visa and be able to live in the UK while studying?
Sadly, no.
No, that's a straight no. How would we do exams online? Well, this is a good question and we could talk about it quite extensively. I would just say that there is a wide variety of assessments in our program, all of them online. And you can imagine there are many essays, for example, that you write in your own time, submit, we mark, that's fully obviously online. There are presentations which you can do online using Zoom. There are assessments such as so-called 24-hour assessment when you were given a task, for example, in statistics, and you have to send back basically, or not in email, but on our virtual platform, you can upload your responses within 24 hours. So there are lots of possibilities to carry out assessments online. Would we need to get a student visa if we wanted to come to campus or work on our dissertation or so?
So this is what I would say, and I don't know what the official line is. So you can't get a student visa for our program. But if you were visiting the UK over the summer and doing your dissertation, I think that's probably fine. As long as it's within the sort of conditions of whatever your visa requirements are for the UK. Rahima, did you want to add to that?
Yeah, that's correct. It's just saying we don't, so to get a student visa, you need a CAS letter or something like that. We will not provide that because we are a completely online program. You don't need to be in the country to study our program. But again, like you said, if you come for any other reason, you can carry on some work as long as it's within your visa requirements or visa restrictions.
And then just to add, I think this was also part of a previous question, which I forgot to answer, that the supervision is fully online. So you don't need to meet your supervisor physically to carry out your dissertation. Your supervisory meetings will be like, well, not in a webinar, but in a Zoom meeting where you can actually ask questions and have a chat with your supervisor. And you will obviously do your work wherever you are. But the supervision is online, so you don't need physical, you don't need to be in the same room with the supervisor to do an effective and good job. And the last question, I think it's very good considering there is only 5 minutes left. And this is, I think, for Serena, because it says, what's the likelihood of obtaining a job in public health in the UK after completing the program? I'm an international prospective student.
You know, I actually, this is a difficult question, mainly because of the visa situation. And since Brexit, I mean, it depends what country you're from and the visa requirements and all of the rest of it. So I think it's quite difficult. There's a lot of jobs around at the moment in public health. Since the pandemic, there's been a huge surge in jobs at all levels in public health. You know, I was an immigrant here at one point. I'm from Canada originally, and at that time, you know, to get sponsorship to come work in the UK was difficult. And you had to, you know, we were part of the EU then, and we had to prove that there was no one else in the EU that could do your job in order to get hired. So it wasn't easy. So I don't know. I don't know the answer to that, because I don't know what your specific visa situation is. So I think that would be challenging. That said, you know, if you can get around the visa requirements, there's a lot of jobs around at the moment, and it's definitely worth looking. And some jobs, everything has changed because of since the pandemic, and the world has gone online. So there's lots of jobs which are fully online, fully virtual. So I know people who are working for lots of different organizations across the country because they do everything online. Then obviously you'll be very skilled in that if you do our program on how to develop, you know, effective relationships in the online environment and so on. So yeah, I think it's worth looking. And you know, you can have a look now while you're waiting. You know, there's all kinds of international job search agencies. Things are posted online. You know, have a look, see what roles are available and what the visa requirements are. I think if you had been an international student in the UK, there's a visa that you can get after you complete an MSc to be able to stay and work. And unfortunately, because we're not able to offer visas for our students, that's not something that you'd be eligible to apply for. So sorry, a bit of a tricky question.
No more questions. That was the last one.
That was the last one. Great. So just before we sign off, do get in touch with us. Rahima's put her email address at the bottom there. Either her or her colleague Rebecca will answer that, and you can book a one-to-one with Dennis or I, and we'd love to have a chat and answer your questions and hear more about you and you know what you're thinking about and considerations for the program. So we're very happy to do that. Yeah, and if there's anything else, you know, we'll put the recording online. The prospectus has lots of information on there. And you know, you can find out more about individual modules and so on, and just do get in touch, and we'd love to hear from you and love to get your application.
Yeah, it would be lovely to see you in September.
Yes. Oh yes, and Rahima's finally put the MS Office forms on there as well. So again, give us your email address if you'd like us to follow up and send you any additional information or events that we might be running that you might be interested in. All right.
Okay.
1 minute early, I think we'll sign off.
Oh, good timing.